360 room scan. And this is my doctor's orders. My MR. Scenario. Dump sheet. Monograph. And compatibility chart. Okay. So I'm just gonna hand sanitize. I'm gonna read my scenario. So, all right, I'm gonna do my ID first. Megan Hughes, 391434. So Allison Chinook is a patient who has been admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 1500 and Allison is due to receive an antiemetic 6 hours after her first scheduled chemotherapy. So I'm just going to initial here. Okay, and first I'm going to hand sanitize. I'm just going to compare my MAR to my doctor's orders. So this is Allison Chinook, ID 61497, 61497, 3042, 3042. Date of birth is December 11th, 1960, December 11th, 1960. So we're giving a med at 1500 hours after chemotherapy. So that's dexamethasone, 4 milligrams. Delivered IV piggyback Q6H after chemotherapy. We're just gonna make sure that is ordered. So dexamethasone, 4 milligrams, IV piggyback Q6H after chemotherapy. Okay, so that is correct. I'm going to put this over here because I don't need it. And I'm just going to do a brain dump. Okay, I'm going to hand sanitize, and I'm going to check my monograph for dexamethasone for instructions for administration and dilution. So dexamethasone, safe dose is between 4 and 20 milligrams, which is good. We're giving 4 milligrams, so that is safe. We are infusing, IV infusion is with a 50 to 100 ml mini bag to infuse over 20 to 30 minutes. And there are no known allergies, so this should be good. Some side effects could include weakness, myopathy, nausea. She doesn't there's no contraindications that would affect her, so that is good. So we are going to be infusing with a mini bag. So you need a 50 to 100 ml mini bag infused over 20 to 30 minutes. We have a 50 ml mini bag, and this has 0.9% sodium chloride in it. She has no allergies, and it is compatible with dexamethasone, 0.9% sodium chloride, compatible. So we're gonna do my 3 mini bag checks. 0.9% sodium chloride, 50 ml mini bag, diluting 4 milligrams of dexamethasone via IV piggyback. So 0.9% sodium chloride, 50 ml mini bag, diluting 4 milligrams of dexamethasone via IV piggyback. 0.9% sodium chloride, 50 ml mini bag, diluting dexamethasone, 4 milligrams via IV piggyback. So that is my 3 mini bag checks. Expiry date is March 2021. This is intact. So that is good. I'm going to hand sanitize. So I'm going to get my med ready and my administration tools. Okay, so I will need a blunt fill needle since we have a vial here. So this is intact. Expiry date is 2024, so this is good. We have dexamethasone, 4 milligrams per 1 ml, and we are giving 4 milligrams, so we will be drawing up 1 ml. The expiry date is 2024, so this is good and it is intact. have a 3 ml syringe, which is good for 1 ml. And this is intact, expiry date 2025. So all of these are good. And I'm just going to hand sanitize and get ready for my first med check. Okay, so this is for Allison Chinook. We'll be giving dexamethasone 4 milligrams Q6H. This is dexamethasone 4 milligrams per 1 ml, so we will be giving 1 ml. We are delivering this via IV piggyback. Q6H at 1500 hours. It hasn't been given yet, so that is good. And this is October 4th, 2020. This is an antiemetic for nausea after chemotherapy. So that is first med check completed. I'm going to hand sanitize. Okay, so I'm just going to get a swab ready. My syringe and vial. This is unopened for testing purposes. That lid does not go back on. Okay. Okay, so I'm just going to open my swab. I'm going to take this off and swab for 30 seconds. So 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 16, 17, 18, 19, 20, 29, 30. Okay, while that air dries, I'm going to prep my syringe. Being careful not to touch anything. I'm going to open my needle and attach. And I'm going to draw up 1 ml of air, not touching the plunger. This is now air dried. And I'm going to put in my air and draw up medication. Okay. So this is my sharps container. And I'm going to pull back so I can get air bubbles up to the top. Get rid of my excess. Maintain bevel so it doesn't drip down the needle. Alright, so this is 1 ml of dexamethasone, no bubbles.
1 ml confirmed, no bubbles.
Okay, so I'm going to recap my needle safely, not touching anything. And this can go here now. Garbage. Okay, so I'm going to put that away. Hand sanitize. I'm going to prepare for my second med check with my full syringe, my med bottle, and my MAR. Okay, so I have Allison Chinook. We're going to be giving 4 milligrams of dexamethasone. This is 4 milligrams per 1 ml. 4 milligrams of dexamethasone. I have 1 ml in my syringe. This is given at 1500 every 6 hours and has not been given yet. And it is October 4th, 2020. We're delivering this via IV piggyback. And this is antiemetic for nausea for after chemotherapy. So I have 4 milligrams of dexamethasone per 1 ml. I have 1 ml in my syringe, 4 milligrams for Allison Chinook. So that is my second med check completed. I'm going to sanitize. And I'm going to create my label. So I'm gonna create my label using my MAR and my medication bottle and my med. So I have Allison Chinook. I have dexamethasone. Dexamethasone, 4 milligrams. I have 1 ml in my syringe. We're infusing this with a 50 ml mini bag of 0.9% sodium chloride. And delivering this via IV piggyback. It is October 4th, 2020 at 1500. This is nausea. And we're giving this every 6 hours. Q6H. I am practical nurse learner. Initial. Okay. This is my label. Okay. So I am going to grab another swab. We've checked the expiry, compatibility, and this is intact. Second med check is done, and now I'm going to swab my port into my mini bag for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 25, 26, 27, 28, 29, 30. All right. So now I'm going to grab my medication, keeping sterility, and I'm going to infuse my med. Okay, and this can go into sharp spin. Okay, and now I'm just going to mix this gently around. Okay, and I'm going to put my label on. I'm going to hand sanitize. Now that I've done my med checks, I can now discard my medication. Sure. These can go into garbage. I'm going to bring my monograph, compatibility. And my MAR. So 2 med checks were done. And my doctor's orders. My secondary line label, which I'm actually going to fill out before I leave. So this is at 1500, 100 initial MH. Solution is 0.9% sodium chloride. Secondary line. Okay. Okay. It's going to be this. Hi Allison, my name is Megan Hughes. I'm going to be your practical nurse learner for today, and I'm just going to be giving you some fluids to help with your nausea. So I'm just going gonna check your bed breaks quickly. Bed breaks. I'm gonna raise you to proper working height and give you some privacy. How are you doing today? Good. Have you had dexamethasone before for nausea? Oh, good. And you had no reactions? Okay. Do you mind if I set this stuff at the end of your bed? Great. So I'm just going to do an ID check for you. Make sure we have the right patient. Okay, so I'm gonna grab my marble. So this is for Allison Chinook. Allison Chinook. Hospital ID 61497-3042, 61497-3042. Date of birth is December 11th, 1960. Date of birth, December 11th, 1960. So that is great. And could you please tell me your date of birth one more time? Perfect. And you are Allison Chinook, correct? Okay, I'm just going to use my hand hygiene. So I see you already have a primary line, and it is running. I see drips flowing. It is open. So this is, okay, this was given at 1100 this morning, October 4th, 2020, so that is great. It is normal saline, 0.9%, so that is perfect. Okay, just making sure everything is flowing. And line looks intact. Drips are flowing. No bubbles. Everything looks good. Clamp is open. Okay. Perfect. I'm just going to assess your site quickly. So I see this was put on and changed this morning as well at 11 a.m. And your site looks good. There's no redness, swelling, bruising. Does it feel okay? Yeah, perfect. So there's no itching. Okay, great. And yeah, your tubing looks good. Drips are flowing. Okay. So how is your pain level? Oh, good. So those are my 3 assessments. I'm just going to go ahead and get ready for my 3rd and final med check. Okay. So I am going to be with your ID again, Allison, and I have my MAR, my med, and my ID band. So this is for Allison Chinook. Allison Chinook, we are giving 4 milligrams of dexamethasone, 4 milligrams of dexamethasone. This is my 50 ml mini bag, and it is compatible with 0.9% sodium chloride. We are delivering IV piggyback at Q6H at 1500. This is for anti-nausea, and it is October 4th, 2020 at 1500. Date of birth is December 11th, 1960, December 11th, 1960. And this is dexamethasone, 4 milligrams, 50 ml IV piggyback, and October 4th, 2020, Q6H at 1500. This is for nausea. So that is my 3rd med check. Those are all correct. I'm going to hand sanitize. So your primary line right now is 0.9% sodium chloride. The line is intact, it is flowing, clamps are open, and I am going to check compatibility chart one more time for your primary bag. I'm going to make sure that is good. So dexamethasone, 0.9% sodium chloride compatible. 0.9% sodium chloride is your primary line, so that is good. I'm going to open up my secondary tubing. It is intact. Expiry is 2024. This tubing is good. Okay. I'm going to take up my hanging. Open my swab. So I'm going to swab the port for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, and again, this line, all clamps are open, drips are flowing. I am going to keep this sterile and attach. Oh, we did not break sterility, so that is okay. And I'm just going to make sure that this one is clamped. And I'm going to fill up 3/4. Okay, so that is back primed to the line, no bubbles. It is now closed, primary line is open and flowing. So I'm going to grab my mini bag. So as you can see, drips are flowing on my primary bag. This line is open, this is closed. And I am now going to spike my bag, keeping sterility. Okay, now this line is still closed for right now. So primary bag is flowing, that line is closed because I'm going to hang this for gravitational purposes lower. And I'm going to infuse the pump to diffuse over 20 to 30 minutes at a rate of 100 ml per hour. We are infusing 4 milligrams of dexamethasone in a 50 ml mini bag of 0.9% sodium chloride. Okay, and I'm going to release this clamp now that the gravity line is set up. And I see drips are now flowing, so that is good. Line looks good, there's no bubbles. It's not tangled. Okay, and I am just going to sign the MAR quickly. Then do my 3 patient teachings. So we have signed the MAR, because that medication has been given. Okay, and so with this medication you may feel some muscle weakness, maybe even some nausea. If you see any allergy reactions occur, please don't hesitate to call us. I know you do not have any allergies. Was on your chart, and that's correct, right? Yeah, no allergies. Okay. And if you see any hives, if you feel like you're burning up with a fever, any of those or anything else that you're concerned about, please let us know. Try not to tug on your IV site, be aware of where it is, and keep an eye on the site. Look for any edema, ecchymosis, any large amounts of bleeding throughout the site, any infiltration, so signs of puffiness underneath the skin and where it is inserted. And don't hesitate to push the call bell. I will hand that to you right now. I'm just going to lower your bed all the way down. Okay, and I'm just going to hand sanitize. You have your call bell. Is there anything else you need? Okay, I'm just going to check one more time. So your drips are flowing on your primary or your secondary line. Everything looks good. All clamps are open. Your flow rate is set. Okay, just going to tidy up for you. Exit the or actually before I exit the room, I'm going to put your secondary line on. There you go, we don't want to forget that. Going to hand sanitize. Okay, exit the room, hand sanitize, done.